Hello everyone, thank you for joining us.
Good evening, everyone, and thank you for joining me live today. I'm Swati Sanyal Tarafdar, a cognitive hypnotic coach, an independent journalist, and a journalism mentor. My work blends therapeutic coaching with a deep understanding of human stories and societal patterns. Today, I'm truly grateful to hold this space with Mr. Nitin Shah, CEO of ICHARS, Institute of Clinical Hypnosis and Related Sciences, and one of the most influential mentors in the space of mental health and integrated therapy. Hello, sir. A big welcome to you. Um,
Hello, thank you Swati for hosting us today, for taking this session forward.
My pleasure, sir. Can you please tell a little bit about yourself, how you introduced or launched iChars into this space, the organization, the work that you all are doing, and all the powerful initiatives that you are leading?
I'm going to keep it really short and crisp because there's enough and more information available about me and about on the internet. My name is Nitin Shah. I head in a couple of organizations. I founded ICHARS, which is Institute of Clinical Hypnosis and Related Sciences. Um, we train psychologists, coaches, and we help them incorporate a more eclectic, holistic framework into their practice. Uh, then there's Meet Goals, which is an initiative that we've launched. It's an organization that focuses on corporate wellness programs, where we offer a combination of training programs, mobile app, and one-to-one therapy and coaching sessions as may be required for the employees in an organization. The app and the initiatives in the corporate wellness are more focused on productivity while keeping in check the mental and emotional well-being of the employees. Then we have the ICHA Support Foundation, which focuses on, which is an NGO initiative, focuses on mental health well-being, but for people who are from a marginally backward um, section of the society. And then we have Visit MHP, which is a peer learning and support community for psychologists. And lastly, there's a book which is called Destiny of Choice, and there's another one which is on in works. Probably in a couple of months, we should have some good news about the same. So that's long and short of everything that we do. If you're looking for more details about me, you can obviously find those details on my website, which is nitinshah.info, or on the iChar's website.
Right, thank you, sir. And I'll take a moment to say that book is fabulous. So anybody interested to get a little deep into psychology and counseling, understanding the mind, that's a sure place to go. Um,
Thank you.
Today we are diving into, yeah, is it all right?
Yes, it's all right.
Yeah, you can, yeah. Today we are diving into a topic that's really spoken about in its full depth. Addiction is a coping mechanism for most cases. And we are talking about when addiction goes wrong as a coping mechanism. Addiction is misunderstood as simply a lack of control or willpower. But beneath the surface, it's frequently a survival response, a way to cope with deep emotional pain, unresolved trauma, or unmet needs. Whether it's alcohol, social media, binge eating, or even overworking, many of us use these behaviors to escape discomfort, mask anxiety, or numb inner turmoil. And coming from the journalism fraternity, I cannot say more about this. I mean, we see these kind of hidden addictions in almost every journalist. In this session, we will explore why people turn to addictive patterns, what these behaviors are really trying to protect them from, and how we can support healing by addressing the underlying emotions and beliefs rather than just the symptoms. The conversation is for anyone who is struggling or supporting someone who is going through addiction or working professionally in spaces where these patterns often emerge. So, together, let's understand how we can shift from suppression to transformation and from coping to conscious healing. So, let's dive into today's topic now.
Perfect.
So,
Yeah.
sir, when we say addiction, what are we actually talking about? And has that definition changed over time?
Okay. So I'll give you how I understand addiction and how we work with it, right? When we actually consider something an addiction. So whenever you are doing something which you are not able to control, which means even if you wanted to stop it, you are not able to stop it. Even if you're facing consequences because of that behavior or because of that act, and you're not able to stop that act or that behavior, addiction, right? Uh, there can be certain addictions that can be positive. When I say positive addictions, it simply means that you feel compelled to take action towards those things, but as long as they are not causing a negative consequence, you are not losing anything out of it, or you feel that you'll still be able to control it, then it's fine. But the moment you're not able to control it, then it will become an addiction. And again, when I say you're not able to control it, when people say, uh, you're doing overdoing this, and we end up saying, if I wanted to control, I could control. So just don't say. Try doing it for a few days. If you're able to control it, fair enough. But many a times you'll realize that your ability to assess what you can control is thoda a bit misplaced when it comes to addiction.
Right. So, would you like to say a couple of words more about how we all are subjected to addiction in some form or the other, probably in temporary phases? I come from being a journalist and working with journalists all over the globe, and this is something that we talk a lot about, but not from the healing aspect. Like somebody procrastinating, what they are doing, they're either lying on the sofa and watching Netflix, or yeah, binge eating is big. Most journalists will meet are obese. Sorry to say that, folks, but that's the truth. So, if you could shed some more insights into this matter.
Okay. Um, so when we are talking about addictions, uh, like I said earlier, this is that behavior that we are doing and doing and doing to an extent where it's causing a problem and we are not able to control it. Now, all of us can identify certain phases in our life where this is happening. You may have just started watching a TV show, a Netflix or a promo or a Prime show, and you found it so exciting, so entertaining that even when you are working, when your focus should be on the work, you're thinking about that show. And you want to finish your work earlier because you want to go back and watch that show, right? You're at times not even finishing the work effectively. You just want to get it done no matter how badly it is done so that you can watch that show. Now, if you're reaching that phase, at least temporarily, you are experiencing a degree of addiction. Though in most cases, because it's about that one particular show, the show will come to an end. Hopefully, the next show will not have the same kind of excitement as this one has, and you may notice yourself settling down again. But if this happens, irrespective of the show, right? And at times, even when you know that the show is bad, and yet you are constantly watching it and watching it at the cost of avoiding other things which are more important to do. Then
Yes.
now we are talking about moving beyond temporary phenomena into a more dangerous, a more addictive behavior. Time pass eating is something that almost all of us have experienced, right? There are times when we have nothing else to do. We are walking around, we are not hungry.
Yeah.
We know, in fact, at times we are full. And yet there's something or the other that we keep munching.
Yes.
Again, if it reaches a place where you're not able to control it at all and it happens on an ongoing basis, then it can be a more serious addictive disorder. But if you are able to, if it's happening on an intermittent basis, I would still call it an addiction, but probably not to the degree of a disorder.
Hmm. Okay. Okay, then we have social media, which is something that's bothering us across the entire age range, starting from teenagers, even younger than teenagers, just the moment they start having the phone in their hands, and of course, us.
See, so again, it's not just about social media or it's not about internet, because these are tools, right? If you're using them in a way in which you're able to control its usage, and when I say control its usage, I'm not saying in terms of time, because for example, if I am someone who's a digital marketer, my usage of social media would be completely different from someone who's probably supposed to be uh, in a sales job where I need to actually physically go and meet people, right? So when I'm saying controlled usage, I'm not talking about how much time, because the time duration will change from people to people depending upon how and why they have to use social media. But if you're
Yeah,
using social media for purposes which you know is not something that you need to do, or you're using the social media at the cost of something else that you're supposed to do.
absolutely. Yes.
For example, I need to go off to sleep, but I'm sitting with the phone in my hand and I'm mindlessly scrolling. Ideally, I know I should be sleeping,
Yeah. We all do
and
that.
yet I'm mindlessly scrolling,
Yes.
right? I am going to the internet because I need to research on a particular topic. I go onto the search platforms, I type, and then all of a sudden one video or one notification pops up. I start watching what is there on the notification. That notification has nothing to do with what I was supposed to research.
Yeah.
It's probably something which is purely of no value to me. And yet, because it keeps me engaged, I continue remaining engaged with it. And then I keep scrolling again. Or I keep watching things which really are not what I was supposed to do right now. Then it becomes a problem for children, right? Many a
Yeah.
times they will get engaged in online games. Now, if there's a time dedicated to those games and they're actually watching those games, makes sense. But right now is a time for them to, let's say, go out and meet their friends. But rather than going out and meeting their friends, they're choosing to work on that phone. And again, to an extent where they want to go out, but they're not able to stop themselves from playing. Addiction. So all of these would be examples of addictions, and they're all. Some of them are. Well, some people have addiction to news.
Yeah.
You're watching the same news over and over and over again. Well, it's almost playing on a replay, and you're watching it,
Totally.
right?
Yes, sir.
So there would be
Yes, sir.
different kinds of these addictions.
Absolutely. So, what the takeaway so far is like addiction shows up in subtle everyday forms and not just alcohol or drugs, which we have heard so far, but of course, things like social media, food, or work. So, now that we understand that, that addiction is not the real problem, it is a solution, it's a coping mechanism. What do you mean by that coping mechanism?
Okay, so let me put it this way. Let me change that statement slightly. Uh, Addiction by itself is also a problem because it leads to its own consequences, right? But addiction is not the cause of the problem. Addiction itself is an effect. So while addiction may cause other problems, addiction also is an effect of certain underlying problems that we may have. Let me share a example with you. Let's say there is a man who has now reached an extent where every day he's drinking. He comes home and he has fights with his wife and his mother both. Both of them are very worried. They bring him to a therapist. Okay, and they tell the therapist he needs to quit drinking because otherwise he is creating a lot of chaos in our house. When you hear this story, who do you think is at fault right now? The man
The
who's drinking? The first impression is the man is the one who's drinking.
yeah.
So the person who's probably at fault, who has a mistake or the problem, is the man. Is
Hmm.
this man,
Yes, yes.
right? Uh, Now let's do a slight backtrack to understand what made him start drinking. So this was a person who was having a good job, was doing good in his life, everything seems to be working out fine. Um, was in a relationship with this girl. The relationship was going on very smooth. So things were going on quite well. The relationship with the mother was also quite well. So things were sorted, life was good. Then one day he got married. His equation with his wife still remains good at a personal level. His equation with his mother also remains good. So he, to that extent, is still able to deal with them independently,
Yeah.
but with each other. But the mother and the wife seem to have a conflict with each other because their expectations from each other are not being met. Both of them are becoming angry and angrier with each other. So where do they express this anger?
On the person,
On the
on the.
person, on this man,
Hmm.
right? Now, it reaches a place where the moment he completes his work and reaches home, first the mother is waiting on the door to complain about the wife. Then by the time he reaches from the door of the house to the door of his room, the wife is waiting to complain about the mother. This
Right.
happens constantly, constantly, constantly to an extent where even when he's working, his work starts getting affected by all of this chaos. Once his work starts getting affected, his boss starts noticing this. And now for his boss, he was a star performer. So there's a problem because the boss's end line also depends upon the performance of this man. So the boss sits with him and has a conversation with him. Asks him, you know what, you're one of our star performers. If you end up not performing, that's a big problem for the entire team. What can we do for you?
Hmm.
The man explains to the boss what is happening, but doesn't know what kind of a help he can seek from the boss. So the boss is all right. For a moment, forget all of this. We are going for a party. Can we go for a party together? The man says, okay. So they go for a party. In the party, the boss is having alcohol. So the boss offers that drink to the man, saying that, can you do you want to have one? This man has heard in the past that alcohol helps you relax. So he takes that first pack, drinks,
Hmm.
takes
Yeah.
the second pack. By the time he reaches home, he's in that state where he's already under the influence of alcohol. Now, what does alcohol do? It takes away our inhibitions. So he reaches home. The mother is still waiting on the door. The mother starts telling him about all the things that the wife has done, and he's angry. But till now, because of the respect that he has for the mother, the love that he had for the wife, he would keep it to himself. Right now, those inhibitions are gone because of alcohol. So now he starts getting angry with the mother, and eventually tells the mother, "If you have a problem, leave us." Now the mother is in shock. She
Yeah.
goes quiet. He goes into his room. The wife is waiting. The wife starts, and he says the exact same thing to the wife. "You have a problem, leave." The wife is in shock. Both the mother and the wife are quiet. The man, after a long time, has a chance to sleep peacefully. Wakes up in the morning dreading, realizing that kal kuch to I have done wrong. Both the mother and the wife come to him together and tell him, you know what, you should not drink. When you drink, you become a different person. Do you know what all did you tell us yesterday? And all of a sudden the man realizes, all right, so I was able to say what I wanted to say. Both of them were quiet. I was able to sleep peacefully. And who got blamed for it? The alcohol. Now,
Yes.
every day when I come back home, wouldn't it be a good strategy to have a couple of packs? Now,
Right.
initially, he starts it as a strategy. But given that alcohol is addictive, the effectiveness of alcohol reduces, the quantity of alcohol increases. And then it reaches a place where he's no longer able to control it. You take him to a therapist. Even if the therapist works with him with respect to his alcohol and with respect to his alcohol alone, the original problem of the mother and the wife fighting with each other is still not addressed. So if you take alcohol away from him,
Hmm.
which you might be able to, he will find something else to cope up with what is happening in his family. And what he picks up may actually be worse than alcohol. So this is why we say that alcohol by itself or addiction by itself is not the problem. It is a problem to an extent that it causes long-term consequences. But it's also an effect of certain other things that are happening in our lives. Right? And if you want to actually concretely address that addiction, you also need to address the underlying causes of that addiction. I am not taking away from the fact that certain people may have personality types which may be more prone to addiction. But those personality types also require external triggers that drive them to the alcohol, and then the rest happens. So you will need to help the client address those triggers as well. Let's extend this further. We spoke about alcohol right now. Let's talk about time pass eating. What does time pass eating really mean? I have nothing else to do with my time. That lack of work is making me feel uncomfortable because I am not comfortable in my own company in many cases, right? So I'm not comfortable with myself. I have no work to do. Now, in order to keep myself busy, I need to do something. I see something to eat, I keep munching, right? It's still helping me cope up with the anxiety that I would have experienced otherwise because I did not know what to do with the time.
Totally. And you make a fair point, a very valid point. I think many of us would get that. Spending time with ourselves has become so difficult. You want to say something about that? And I'll come to the question of like, you gave a very traditional example with alcohol and this person. But most of us who are who are getting into some kind of an addiction because of fear, because of anxiety, as a freelancer, I know there's a lot of uncertainty in our lives. So, how are these affecting our daily behaviors and how we can kind of tackle these?
Okay. So I'll come to both questions one by one. First one about spending time with ourselves, right? Just sit every day for 5 minutes, not doing anything. I'm not even saying meditating. I'm saying just sit, not doing anything.
Right.
Okay? And see if you can achieve that. If you can, then we are at least at a decent place, right? And again, I'm not saying that sit and meditate because meditation is also an act that you are doing which will help you pass the time. Just sit by yourself, not doing anything.
Yeah.
Okay? Uh, and that will give us an understanding of how comfortable we are in our own company.
Yes, sir.
About the second part that you asked, right? About anxieties and so on. So again, see what alcohol does. When you are having that alcohol, it takes away your inhibitions. It takes away all those things that you're constantly worrying about. It provides you a temporary relief from those anxieties that you're experiencing, right? So, for example, let's say there's someone who is a reporter, has to go and report about a particular news incident, and that news is supposed to be covered in an area where their life may be at risk. Now, while they may be comfortable with the idea of their life being at risk, there are family members who are constantly calling them, checking upon them, asking them, and that all can become very overwhelming because it may not be about their own life, but it's about what will happen to these people if something happens to me,
Hmm.
right? Now, the moment that anxiety starts coming up, while you're reporting, you're focused on reporting, your life is at stake, you're running around, so you're still all right. So there's something that is keeping you engaged. But once that reporting ends and you're by yourself and the camera is not rolling, now all of those thoughts come back. What if something happens? What
Yeah.
happens to my family? What will I tell them when they're calling me? Why are they calling me again and again? And all of this starts creating a degree of discomfort, which may reach a level where we don't know how to manage this. So, in that moment, we are looking for some relief. And if you've had alcohol earlier, right? Or if there's anything else, for some people, it can be sweets. So, if there's something that when you eat, it kind of gives you a sense of pleasure, which helps you relax, which helps you calm down, then the natural tendency for the system is to look for that, right? Why? Because it's not that I'm looking for the alcohol or the sweet. I'm really looking for calmness, for relaxation, for relief from all this that is going on in my mind.
Hmm.
And then I go after whatever provides me that relief and I have it. Also, another thing is when I have it, it generally provides me with the ability to talk about certain things that otherwise I would not have spoken about.
Hmm.
Right?
Right.
So when I speak, it also helps me. In a way, it also has a cathartic effect. All those things that were suppressed, that were stored in my system, are also coming out. Now that's a different thing that the way they are coming out may lead to its own consequences later on, right? But all of this together becomes the basis for us to want to go back to that substance over and over again. I'll give you another example. We're talking about coping with anxiety and so on in actual problem situations. I know of people who have got addicted to substance because they thought substance could become a way for them to for therapeutic help. That they wanted to get into substance induced altered state through which they could vent out what is stored in their system, but invariably the association it created in them is they need substance to be able to express.
Right. So this is interesting. Can I assume or can I understand from here that basic willingness to vent, to share, to talk about it is what is pushing them into addiction?
No, not necessary. That's one of the things. So there is anxiety that they're experiencing from which they're seeking relief. Then for certain people, there are so many inhibitions in their mind which prevents them from being able to express themselves. Right? So then
Right.
that alcohol provides them with that opportunity to express themselves. There are certain places where you're just a part of a circle where everyone drinks and you feel out of place if you don't drink. So there's
Yes.
still a feeling of being out of place. Now you are trying to actually address that feeling of being out of place, right?
True.
For
Right.
to give you an example, like for example, in my circle, I know of a lot of people who drink,
Hmm.
and I've been asked this question quite frequently: that why don't I drink, right? Don't I feel out of place and everyone is drinking? The answer is actually I don't feel out of place. One, and second, even if I were to feel out of place, right? For that moment, I would probably prefer to go somewhere else where I will feel in place rather than being over there in that space, right? But that's the way I cope up with it. For certain people, they don't have an escape route. They need to. I know of, so I've had clients who have actually come and told me we have to drink because our boss discusses certain important things over alcohol.
Oh.
So if I don't drink, then
Hmm.
I'm not invited to that party. And if I don't go to that party, then I'm not a part of an extremely important decision that is being made in the company.
True.
Right?
Yeah.
So there are
Yeah.
a lot of peripheral factors that come up, but that alcohol is still trying to serve a purpose in that person's life, whatever that purpose is.
True. So, sir, when somebody is trying to fit in, is it a problem with self worth if increasing self worth with them would help them feel fitting in?
So okay, so there is both a long term and a short term to this, right? If this is happening on an ongoing basis in multiple areas of their life, then it is a question of primarily self-worth. Okay? Or at least self-worth is an important component of it. If they're able to work on their self-worth, if they're able to develop their self-esteem, then at least they will not feel like this in multiple areas of their life.
Right.
But if it's in the example that I gave you, if it's specifically about work where they need to be a part of that meeting to be a part of important decisions and those determine their promotions, right? Then it may not just be about self-worth. But where would self-worth come in? Is if they are not even exploring new job opportunities. So I understand you are in a job, you happen to have a boss like that, you realize that boss is not good for you. Well, not good for you in the sense that that entire system is not good for you. Um, you also know that alcohol is not something that you are keen on, or even if you are okay with drinking it, it's now reaching a place where it's causing problem, right? So what's stopping you from exploring an alternate job? Now this is where people will tell you, but I don't think I'll get a better job. So now self worth comes into play again. That I don't think I deserve the current job that I have. So if I leave this and if I don't deserve this, I can't obviously find something better than this, not even as good as this.
True. Yeah.
Right? And then in that case, I want to stick into the current job, and then again self worth comes into play. Plus, there are other consequences of it, right? So, for example, I stay in the job for the sake of this job. I start drinking. That drinking will influence my behavior with people in my family, right? Now I'll have conflicts with them, and which will again hit my self-worth. That you know what kind of a person I am, I can't even be good to my wife or to my kids or to my parents. So it becomes like a vicious circle where self-worth influences addiction, influences your behaviors, influences your results, which further influences your addictions.
True. Sir, just curious if childhood trauma or any evil kind of memories can also trigger addiction or lead to addiction.
um, See, so when someone has gone through a childhood trauma, what is happening with them? That the emotional imprints of that trauma are still stored in that person's system. They've not been able to learn to release them, make peace with them, and maybe even learn if they have to learn something from it. Now, if they are not able to do that, and those emotions are inside, again, whenever they are by themselves, those emotions will start surfacing. Right?
Yeah.
Because when you are with yourself, there are these thoughts that remind you of certain things, and those certain things that remind you of the feelings that are stored in your body. So that's one of the reasons why we feel so uncomfortable spending time with ourselves, because that time almost forces us to reflect upon what may have happened in our life. In
Yeah.
some cases, we may be aware of what has happened and we may need to reflect upon the actual event. In some cases, those memories by themselves may be repressed. We may not even remember them, but the feelings are still there. And then those feelings become more and more intense when we're spending time with ourselves. So, if I need to cope up with that,
Hmm.
what will I do? I need to look for something that provides me with relief. And because these feelings are inside me, I can't really escape them. Like, for example, with the job, I said you could at least look for a new job. But if these feelings are inside me, wherever I go, the feelings go with me. So whenever I'm alone, these feelings have a way of surfacing. So now I want to cope up with these feelings. I don't want to feel them. I want to seek relief from them. So what do I do?
Right.
Again, go towards something that provides relief, and then my need for that relief becomes higher and higher, which has a tendency to help me get or make me get addicted to.
Hmm. Right. Sir, I would like to look at the solutions for a moment, for some time, because we have talked enough about addictions, why it happens. What can we as psychologists and counselors do? And do we really have tools to help people who come with addiction of all kinds?
Do all counselors and psychologists have the tools? I would say probably no. Do we have the tools? Yes. So, at least in the kind of work that we do, there is enough tools available in the toolkit to be able to address or help people who have addictive behaviors. Uh, Now, irrespective of whether you are from the same cognitive hypnotic psychotherapy fraternity or not, right? This is the way I would ask you to look at addictions. First, we have already discussed that addiction is not the cause, it's the effect,
Right.
right? So you may want to explore what the cause is. So understand, okay, so let's break it down step by step. First, understand the triggers for addiction. What are the different things that happen in the client's life which drive them towards that addictive behavior more? Those triggers will give you an insight into what the client is trying to avoid. So identify the triggers. With those triggers, check what are the current set of feelings they're experiencing. Some people may experience overwhelm, some people may experience anxiety, some people may experience sadness, some people may experience a combination of this. So identify the triggers, identify the emotions, right? We already know that addiction is serving a purpose. One
Yeah.
is that alcohol is serving. Then look for the underlying cause of the alcohol. You may use any of the delayering processes. The processes that we use could be SVIT, EET, corrective therapy. But even if you're not trained in any of these models, if you're really good at asking questions, you may be able to use questioning tools to at least help people reach some degree of causality. What is the cause that's driving them towards this particular behavior, right? Then look at addressing that cause itself. So, whatever are the past experiences, emotions associated to it, help them release those emotions, replace those emotions, help them witness those experiences from a distance so that they can see if they can learn something from them. If there were certain skills that they needed to develop,
Right.
right? And then help them apply those skills in present and future. While you're doing this, especially with certain people who have addictive tendencies, which means Biologically, they are more prone to those addictions. You may need to ensure that they stop taking the addictive substance completely, right? This is where a buddy system can come into play. So, for example, in Alcohol Anonymous, you have your own you are a part of a group where you will have a buddy, you will be having a conversation with them, they will be able to keep you on track, you will keep other people on track. So that kind of a support can come handy. Though that support by itself also may not be enough. That support is good to keep you going. Once you have been able to address whatever the underlying causes are, to ensure that if in future any additional triggers come up, rather than going to the addictive substance, you will probably reach out to them first, and then you can reach out to seek help and see if additional therapy is required for you. But this as a whole becomes a package that I would recommend to help people deal with addiction, especially when it comes to alcohol, when it comes to um, any kind of drugs, because they have addictive elements in themselves. When we were talking about other addictions like eating, like working out, then for those places, maybe you may not need something like an Alcohol Anonymous, but working with the underlying causes may still be required.
Right. So I'm curious to understand, sir, that there is, first of all, how does hypnosis play a role in this whole healing system that ICHARS have developed? And if you can talk a little bit about the eclectic method that you particularly have developed and that you teach us. Also, what you explained so far is something to do with the thought restructuring and the right the NLP
The
and
key is
all of
not just thought restructuring. It revolves around everything. It revolves around working with thoughts, working with emotions, working with past experiences, developing skills required to cope up with the environment, right? So all of this together needs to be done. Um, when you ask about hypnosis, where hypnosis comes into play for this, so one is when people want to quit any of these addictions. So let's say someone is compulsively eating, they want to manage their weight, they want to make the choice of not eating compulsively, but the moment they look at food, no matter, something happens. At times they don't even realize that they're eating. So now what's happening? Consciously they've already made a choice that I want to cut down on my behavior, but something inside them takes over, because of which they are not able to control that behavior, which is when it becomes addiction. Remember, we spoke about addiction as a behavior that you want to change and yet you're not able to change, right?
yes,
Or a behavior that even if you wanted to change, you will struggle with changing it. So if you want to change it, that means consciously you already made a choice, I want to change, but I'm not able to. That means something beyond the control of the conscious is influencing that behavior. That becomes the unconscious. Hypnosis is simply a tool to help us connect to the unconscious and work with the unconscious, right? So that's the primary role that hypnosis plays. It gives you the mechanism to connect with the unconscious and then create whatever changes need to be created in the unconscious, so that that unconscious can be in sync with the conscious choices. Okay. Now, as far as the eclectic therapy is concerned, so since I described that hypnosis is about connecting with unconscious, but once you've connected with unconscious, what do you do next? Which specific therapeutic tool will be best to work with a particular client in a particular circumstances, right? If a particular tool is not working, how do you tweak that tool to be able to incorporate additional modalities if required? Let's say you start working with helping clients manage their thoughts, but while trying to work with their thoughts, they remember a childhood memory. Then only working with thoughts is not enough. Then you will also need tools to be able to cope up and work with that memory. So all of these tools that are required to help people address the different challenges which are preventing the unconscious from coming in sync with the conscious are the therapeutic models that are available. So in the eclectic approach, what we have done is we have taken hypnosis as a base to connect with the unconscious, and then we have taken techniques from cognitive approach, behavioral approach, humanistic approach, psychodynamic approach, mindfulness, spiritual healing, a lot of these approaches together, so that they can fit in with the requirement of the client. And then depending upon what challenge the client is facing, hypnosis is combined in combination with one or more of these techniques. That's what makes it a eclectic approach. So when you asked earlier that we are talking about thought restructuring, that's the reason I said we are working with multiple layers. Because the eclectic approach gives us that ability to work with each layer that the client may be struggling with. Be it thoughts, be it emotions, be it their specific beliefs, values, secondary gains, past traumas, intense experiences, repressed memories, all of this are handled traditionally through different therapeutic approaches. We are able to bring them all under one umbrella and connect it with hypnosis.
That's beautiful, sir. I would ask you to delve a little deeper into this eclectic model of yours, and if you could talk about how one can learn this across from your ICHARS, of course, the way the courses are divided and all of that. I know a lot of people are curious.
Super. So, two parts. How the eclectic approach uh, is designed in two ways. One, there is a conceptual breakdown, like I gave you right now. So, even if you are not trained in CHP, but if you have been trained in multiple modalities and you understand the framework correctly, there's a possibility that you will be able to apply the framework to a very good effect. Having said that, if you really would like to incorporate it as a part of your practice and if you would like to make this as your core approach, then it's always better to do a course that trains you in it, where you are actually noticing demonstrations, where you are working under supervised practice sessions, so that you can incorporate all of this as a part of your practice. Right now, for that, we created a course called Cognitive Hypnotic Psychotherapy. The program is a 4 level program. It basically walks you through the basics all the way up to the advanced. And even after you complete the course, we have constant case discussions, interactions with participants to ensure that if they're struggling with any specific client, then we are able to offer them with support, with guidance required to implement the model with the specific clients that they have. One of the most amazing things that the model does is that you're not even dependent on the techniques that you have learned in the model, because by the time the model comes to an end, you have the ability to create your own techniques, right? Which means you can truly provide a person centered approach to a client where your entire approach is designed keeping the client in mind, is flexible enough to adapt to any challenges the client throws at you, and yet it's structured enough to ensure that in your mind you know what the steps are and you don't feel confused and out of place anymore. So that's what the approach is. If you are looking for more details about it, just check out the ICHARS website, or just search cognitive hypnotic psychotherapy. Okay, or you may just do a chat gpt, asking chat gpt most advanced hypnosis courses for it psychologists, and in all probabilities ICHARS will be one of the top institutes that chat gpt recommends to you.
Yes, ICHARS is one of the top institutes, and Sir Nitin Shah is one of the best mentors as well as therapist I can think of, and I always recommend everyone to get in touch. Sir, I'm a little curious to understand, like, when we do this entire eclectic approach on somebody who is going through addiction and want to get out of it. Um, is there a relapse at some point? And what will the same procedure work with them if there is a relapse?
So in the model that we follow, relapse itself is an indicator of something which is still pending. So what does relapse really mean? You do a process with the client, they get relief, which means the mind chose to respond to that therapy process and help the client create the outcome that they wanted to create. And then later on, for some reason, the mind decides to fall back on the old behavior. Now, there are a couple of possibilities behind it. One is there is a new trigger that has come up that we have not dealt with earlier, right? Then it's simply an indicator that an additional trigger needs to be worked upon. Or the triggers are the same, but the mind is realizing that by giving up on alcohol or on addiction, I've given up on certain other things which are extremely important for me. So remember, I spoke about secondary gain. This is where secondary gain comes into play. So let's say someone was using addiction as a way to cope up with anxiety, but one of the side advantages of addiction was that a lot of people were paying attention to them. Their family members were constantly asking them for, do you need any help? Do you need any support? So with all that love, all that attention that they were getting, okay, they also wanted it and they were not getting it earlier. So now when they give up on addiction, while they may have learned to develop additional skills to cope up with their anxiety, there is a possibility that this lack of attention that they're getting is now what is bothering the mind. And because it only knows the previous behavior of addiction as a way of getting their attention, they fall back on the previous behavior. Right? Now, in that case, it's just a signal that, all right, there is this feeling of lack of attention, lack of love, and they need to find a way to be able to address this. I'll give you another example in terms of eating. Right? There are a lot of people who want to manage their weight. They start working out, they start exercising, they start dieting, and everything works out till a limit. And then something happens and they gain the weight again. And they are almost in a yo-yo cycle.
Yeah.
Right? They reach a particular stage, a particular level, and then a fallback happens again. For many people, weight is actually a safety net. So to give you an example, I was working with a client where the client wanted to manage weight but was not able to. When we started working and we started looking at what is the positive intention behind weight, her mind reminded her of a time when she was really young. She went through an experience where she was molested, and when she complained about it to her family, someone in her family told her, if you look this beautiful, if you dress this way, this is what is going to happen with you. Now that created a very strong association in her mind that looking good means that I may not be safe. So now, in order to keep her safe, the mind has learned the behavior of ensuring that she doesn't look as good. She can't wear those kind of dresses. Okay? Which then means that weight itself becomes a survival mechanism for her. So the moment she started reaching a place where people started complimenting her on her looks, instead of that motivating her, the system went into a survival mode and picked up the weight again. Now, so that for us becomes an indicator that there is an unmet, an unresolved issue which we need to explore and address. So yes, relapse can happen, but each relapse is an indicator of something else that we need to do. Again, I'm not talking about people over here, so because again, going back to alcohol and going back to substance, they have their own addictive components, and certain personality types may be prone to it. So for them, abstaining from it is the way, right? But along with the abstinence, all of these are required because then abstinence becomes easier, right? For
Yeah.
other people, for other kind of addictions that we have spoken about,
Yeah.
right? A relapse is just an indicator of something else that needs to be addressed.
Right. So I'll just extend this example a little bit. If somebody is watching Netflix all day and not attending to the article that she is supposed to write, or not studying for upcoming exam, what will they look for if they are trying to diagnose this at home by themselves?
So the primary diagnosis is just this: if you want to do something that you're not able to do, or if you want to avoid something but you're not able to avoid, that is an indicator that you need to seek help. Right? Now, beyond this, as far as the clinical diagnosis is concerned, let the experts do it. Don't get into it, because the moment you get into it, then we start researching on it, and then we end up start creating problems that never existed in the first place. So just stick to the basics. If there is any particular thing that you want to do, but you're not able to do, or anything that you want to stop yourself from doing, but you're not able to stop yourself from doing it, that is just an indicator that you need to seek help. Period.
Is that a good reason to go to a therapist?
That should be the primary reason to go to a therapist.
Yes, I ask this again, sir, because a lot of us think that, okay, this is something I can manage. Going to a therapist is something that's at the end of any list whatsoever. So I'll probably do it myself. And of course, I cannot do it myself, and I cannot go talk about going to a therapist or a counselor because what will people think? And then people will think, okay, छोटी सी बात है, इसके लिए क्यों therapist के पास जाना है? But we all need a coach and we all need a therapist. So if you can just reiterate or explain a little bit about at what point we all should start thinking about taking professional help and how long that help usually is. Like not months and years, but like a reasonable length.
Okay, so two things. When should you start seeking help? Whenever you want, you see that there is a scope for improvement in my life, and that scope for improvement is actually not being materialized. Okay, because the reason I'm saying this is because I don't want to constantly connect therapy only to problems. There are times when your life is going good, you are happy with your life, but you realize that you have greater potential than what you are reaching right now. So you are okay where you are, all your needs are being met. But there's also that slight feeling that, you know what, I know I can do better, but I'm not able to. Even for that, you can go and visit a therapist. And a good therapist should also be able to help you in that case to be able to improve your productivity, to be able to reach the kind of heights you are capable of reaching. Otherwise, just as a simple reference point, what I said earlier, and I'm repeating this again, whenever you feel that over a period of time, when I say over a period of time, for more than a week, you have not been able to stop yourself from doing something that you want to stop, or you're not able to work towards something that you want to work towards, or you're already doing everything that you logically should do to achieve your outcome, but you're not able to. In all these three scenarios, go and visit a therapist, right? I understand that it may be a bit of an effort to find the right therapist. Okay?
Yes.
Not every therapist is same, and not every therapist is equally skilled. Okay? If you're going to ask me, I'm obviously a bit biased. I'm founder of cognitive hypnotic psychotherapy. So I would recommend just look for people who practice cognitive hypnotic coaching or cognitive hypnotic psychotherapy. And those will be the people that I can vouch for, that they will have the tools to work with you. And if you're going to a coach and let's say you require a therapy, they would be able to recommend to you immediately someone who has the tools. So that will be my recommendation. How many sessions? That is difficult to answer without knowing what is the problem for which you're visiting a therapist. But generally speaking, you will be able to observe tangible, observable shift in your life in 3 sessions. Right? Now, how many more sessions are required after that may depend upon a variety of factors. But in 3 sessions, you should be able to notice a tangible, positive difference in your life. That is an indicator that you're moving in the right direction. Right? If you can't see any difference in your life in 3 sessions, then maybe it's an indicator that look for a different therapist. And 3 sessions I'm talking about generally is an upper limit. The results you will begin to witness a bit sooner. But third session is like the upper reference point. On an average, for most issues in the way we work, you should plan between around 8 to 10 sessions. There could be plus minus a bit depending upon how many issues you want to work with. And at times you work with one issue and then you realize, you know what, while this is resolved, I know that I can benefit from therapy. So I may also want to seek help with a couple of other issues. So those number of sessions may change. But as a starting point, 8 to 10 sessions for addressing a specific problem, and third sessions for you to begin to see tangible changes in your life,
Great.
right? And if you're looking for quality practitioners, just search for cognitive hypnotic coaches, cognitive hypnotic psychotherapists, and they should be able to help.
Yes, and whatever sir said so far is for all kinds of issues, not just addiction.
So in fact, like I said, see, so the thing is, for a lot of us, the idea is I need to go to a therapist when things are very bad, right? When ideally you should be visiting a therapist so that things don't become bad. Yeah, if they've already become bad, therapist should also be able to help you there. But you can always reach out to a therapist when you know that something can be improved, you're not able to, so that you don't reach that bad phase. One. You also touched upon the idea, what will people say? And that's one of the reasons why people don't seek therapy. Right? Today, actually, that should not be a problem. Earlier, you needed to go to a physical clinic to be able to work with a therapist, and you were worried people will see you coming out, going out, and there was a lot of, especially if you were a celebrity or someone who felt that there are people who are constantly keeping a track on you. But you can now seek help online from the comfort of your house. um, if you can watch Netflix, you can surely, you have a space, you have an internet, right? You can also reach out to a therapist.
Totally.
So this issue, that what will people think, one, to be fair, therapist will also help you address with that question itself. But more importantly, in today's world, that's not necessarily a problem, because there will always be space available where you can reach out for help, and people around you don't need to know about it.
That brings me to a very important question, sir. It's something that I have faced in a past few clients. They're very worried about the anonymity, the confidential clause. So, if you could tell everyone about the ethics behind the confidentiality clause, how you can disclose with others or not, and maybe for the general people who are also watching, probably that there is no fear. There should not be any fear in consulting a therapist or a coach because your case is supposed to be behind the closed doors.
Okay. So I'll answer this question in two forms. One in general about therapy and coaching, and second about how we work. And because there's a slight difference. So in general, as far as coaching and therapy is concerned, legally speaking, every information that you share with your client, with your therapist or your coach, is bound by a confidentiality clause. You can actually ask them to prepare a document that they sign, you and them both can sign, which will include the confidentiality clause if you want, right? Then we will also have a documented proof that you can use in case you want to sue someone. So which is one. Second, uh, the only space where this confidentiality clause can be broken is if someone's life is at stake. So, for example, if you were to go and tell a therapist that I am planning to kill someone, and the therapist is convinced that there is enough reason for them to believe that you're not just saying this in frustration, but you've actually planned for it and you're planning to do it, then the clause may be broken and it can be reported. Or if your life is at stake, right? So under these two circumstances, that clause can be broken. Also, in case where you are a caretaker of a minor who is only dependent on you, and the minor is going through an abuse because of you, right? Then reporting is mandatory. But if you keep these three things aside, okay,
Right.
everything that you share, no matter what the circumstances are, what the problems are, what you may have done, they are all protected under confidentiality. And if the therapist decides to break it, the therapist can actually be legal trouble.
True.
Now, this is the general framework.
Yes.
The way we work, if you are uncomfortable sharing certain secrets, you can actually tell us that there is a secret that I know that bothers me, but I don't want to share it. And we still have the tools to be able to help you address that in your own mind without you having to tell us about it. So then that confidentiality is not even a problem because you're not even sharing that problem with us. Right? We will ask you for basic details about what you feel and so on, but the specific details that make that information so secretive, we actually don't need to know about. So if you are uncomfortable sharing it, all you need to do is this. Tell us there is a piece of information that bothers me, but I don't want to share that information with you. This information is enough for me to ask you the questions required for me to design a process for you. And for you to give me the information you're comfortable sharing. And then we can actually help you address those issues as well.
Absolutely. I'll, sir, take a moment to repeat what you just said for everyone once more, just to drive home the point. Is there is this confidentiality clause under which none of us, coach, counselors, mentors, are supposed to share with anybody outside the person that we are working with, whatever we are working with. Even the fact that somebody is consulting us stay under the wrap unless the person working with us, the client, is going and talking about it outside. And also, when behind the closed doors, when we are working with the clients, they can still choose to not say certain parts of their experiences, and we will try to work through it. So that's something that we should all have in mind as practitioners and as clients who come to seek help. Sir, we can go on, but I think I still have a long list of questions, but maybe for another time. If
We
you
can
want
do
to
a
add
follow-up
some,
on, so we can do a follow-up on this session later on. We were ideally supposed to do this session with Sachin today from Connect Hub. He was not available because of certain things that came up. So it was very nice of Swati to take up that particular role to help us continue with this conversation. And this was a very last minute thing. So thank you, Swati, for being able to take out the time and for having this conversation. and
It's
for
a
hosting.
pleasure, sir. Thank you
Yes.
so much. And yes, we definitely need to follow on this. And anything else you want to add before we say
No, I
bye?
think we are good. The only thing that I would say is help is available. All you need to do is reach out for it, right? Um, and you will notice that you'll be glad that you actually reached out and did seek help, right? So just you have the opportunity. We are living in a world where at least help is available more readily. Go ahead and hopefully you're able to live a happier, healthier, and more fulfilling life.
Absolutely. Very well said, sir. Um, Thank you so much. And we'll meet again next.
Sure.
Bye for now.
Thank you. Thank you, everyone who have been following up on the series and on the lives. If you have any questions, please leave it in the chat box. We will take them up during the Friday Q&A. And then, obviously, next week we'll have another session planned for all of you.